During the monsoon of 2017, India released a series of health advisories that said alternative medicine could treat diseases like dengue and chikungunya. These notices came from one of India's newest and most popular health ministries, AYUSH. This is not the first time it's happened. Back in 2013, the AYUSH Ministry, along with the Tamil Nadu government, said that alternative medicines were effective in preventing swine flu and leptospirosis. The funny thing about all these messages is, there's no scientific proof to back any of this publicity. The efficiency of complementary and alternative medicines has always been hotly debated within formal medical systems. While Western markets have turned skeptical about their effectiveness, Indians use these products even though there are no patents to indicate how they were made and no clinical trials to prove that these medicines actually work. 2 years ago, AYUSH stamped off an Ayurvedic drug for type 2 diabetes that claimed to control blood sugar and enhance metabolism. But when this story was investigated, there was barely any evidence of its effectiveness, and patients even reported side effects. Tests conducted on AYUSH-approved Ayurvedic medicines have even failed quality standards, indicating that the market for spurious medicines in this sector is huge and worrisome too. What makes matters worse is that Indians seem to love natural medicines. The fact that AYUSH doesn't make prescriptions for such products compulsory affects lives, especially because Ayurveda to cure something like diabetes is not a primary form of medication. It's complementary at best. Despite all this, the AYUSH Ministry seems to be putting more of its resources in promoting this alternative medicine system instead of regulating it. They've been criticized for not using their massive budget for testing and clinical trials, which could control bogus remedies and help genuinely alternative therapies gain legitimacy. And with no neutral body to monitor the AYUSH Ministry, these medicines and messages are even more likely to sway naive patients. And India's health will keep deteriorating.